Agency is one of 15 academic health science networks, and within the Northwest region we are collaborating together with the 6 organisations you can see as part of this collaborative masterclass. So we work with ADAS, Northwest Employers, the Northwest Leadership Academy, AQUA, MIAA, and of course ourselves to bring you these series of great events. So I wanted to just welcome you to this fully digital event. So because it's a fully digital event, please look after yourselves, make sure you get some screen breaks when you need them, take a comfort break when you need them, keep hydrated and keep your sugar levels up. So we don't have any formal breaks throughout today, but so do look after yourselves. So I'm just going to hand over to Alana, who's going to just go through some Zoom etiquette and help you to navigate your way around Zoom.
Thank you. So yeah, everyone's probably quite familiar with it, but I'll go through it just in case. So when you hover your mouse in the middle of your screen, a bar should appear at the bottom. You can mute yourself for now, and then if we do invite you throughout to ask any questions or have conversations, then we'll ask you to unmute your mic. We will be recording the session today, just as an FYI. So if you're happy to be involved in that, then do please keep your camera on. But if you don't want to, then you can stop your video by using that button there. If you want to see who's in the room, then if you click participants, you'll be able to have a little look. And you can also raise your hand in that box as well. So if the box pops out, there'll be 3 little dots. If you click on that, it'll give you an option to raise hand. There's a few of us on tech support today, so I'll keep my eye out. If anybody's got your hand raised or anything, we can see how we can help you. And then finally, we probably will be encouraging people to use the chat box today. I can see a few people are using it at the moment. If you have any burning questions or anything like that, pop those in there and we'll get round to you as soon as we can. If we can't get round to all of your questions, then we'll try and answer them afterwards. I'm on hand as tech support today. So if you need anything at all in the chat box, if you just search for me, ALANA, I should come up, and then you can type me a private message, and I'll keep my eye out. And alternatively, I'll pop my number in the chat as well. So if you're having any issues or any colleagues might not be able to get in, then you can give me a call and I'll be able to help. If finally, I guess, if you are struggling with your signal, it's breaking up a little bit, I'd suggest closing everything down in the background. So if you've got your emails open or any other apps, just try and keep everything else closed. That'll probably help. But enjoy the session, and like I say, if you need anything, let me know.
That's great. Thanks very much, Alana. I think we've all becoming quite expert at using these virtual conferences. So hopefully everyone's used Zoom before. It's really great to get some interactivity. There's an emoji reaction. So if you like anything you're hearing, do encourage the speakers to, by giving them some feedback using the emojis. We do love to see that as well. So just before we start, it'd be great if you could all have a go at using the chat box. Some people are already introducing themselves there, but if you can just say who you are, where you are in the country right now, and one thing that you hope to gain from the event today. If you could pop that into the chat box, we'll begin to see who's in the room and who's our audience today. Thank you. And as Alana had said, throughout all the presentations today, or throughout the talk today, if you've got any comments, anything you'd like to hear, any questions you've got about for the speakers, do pop it in there. We'll be reviewing it as the session goes on, and we can pick out some at the end and feedback to the presenters. So that'd be great. Oh, someone on the Wirral, great, not far from me. Hi, Sue. David in rainy Manchester. I think it's raining all over today, isn't it, really? Oh, over in Blackpool, grand. Rainy Cumbria. Is there anywhere that's sunny today in England at all? I think we've got a dreich day ahead of us, as they say in Scotland. So could you put the next slide on, please? So I'm just going to introduce you to the event. We've got some great talks. We've got a great agenda for you today. What I would just also say is that please do share any learning that you gain from it. If you're on Twitter, we are using the hashtag collaborative NW, so do share far and wide. So this is an overview of the agenda. Hopefully you've seen that before. And next slide, please. And these are the learning outcomes that we are bringing you today. So we want to really help the system, organisations and teams to really understand what a business case for investing in health and well-being is, know what works from the best available evidence, and understand what steps you can take in your own workplace to invest in health and well-being. And then also know how you begin to develop a health and well-being strategy for yourself and others. And why are we doing this right here, right now? I think it's never more timely. We've just marked the 1-year anniversary of the start of the lockdown due to COVID-19. Over the last year, we have lost over 126,000 people in the UK alone to COVID. Our NHS staff and other key workers have worked in unimaginable conditions, facing fear and bearing witness to unavoidable death and harm. As well as this, they've been worried for their own health and well-being and that of their families. COVID has also highlighted health inequalities and inequity in our society and in our health and care systems. If you're Black, Asian, or from a minority ethnic community, you will have been much more likely to be adversely affected by the pandemic. The data supports this. So, COVID has also highlighted the need to look after the mental health and well-being of our frontline staff, not just during COVID, but after as well. So we are expecting a tsunami of mental health needs of our frontline staff and key workers. We are already seeing data saying that they're experiencing depression, anxiety, and even PTSD, and no wonder. They've been asked to place themselves in harm's way and suppress their own feelings of fear to care for the people they serve. So this event cannot come soon enough, if you ask me. Next slide, please. So I'm really delighted to introduce our presenters today, Sue, Claire and Lou. They're facilitating this masterclass. Sue and Claire set up the Health and Wellbeing Inspiration Collaborative after working together in Manchester Health and Wellbeing Board. They were looking at what organisations are doing to support employee health and well-being, and as a result, developed a baseline assessment tool for organisations to assess their approach to health and well-being. This is a free tool to use. They're also supporting the Northwest Leadership Academy to develop a healthy leadership framework. So Sue began her career as a nurse in 1983, and over the course of the last 30 years, she's worked in a number of clinical, managerial and board roles in the NHS and private sector. Back in the 90s, she found herself working in general practice and developed a passion for working in the field of health promotion and reducing health inequality. Claire worked in the field of health and wellbeing back in 1999, where she began her career in health and safety executive. Everybody mute themselves, that'd be really helpful. She was exploring the risks of stress at work. So following this, she worked with clients for local authority and healthcare, supporting them to develop workshops around resilience at work and stress awareness for individuals and for managers. She's also worked within the NHS as an interim health and wellbeing manager. And finally, Louise is a qualified coach and mental health first aider, instructor, sorry. Louise trained to become a mental health first aid instructor as a way to help and encourage others to speak up and seek help, and to help organisations and their leaders take action around mental health. So without further ado, I'm going to hand over to the presenters. Thank you so much for bringing your work to share today. I think you're on mute, Louise.
Thanks so much. That's a good start, isn't it? Yeah, so thank you so much for that introduction there, Juliet. So what we thought today is we'd start with a quiz. Who likes a good old quiz on a Friday morning to get us thinking? Anybody? I love a good old quiz. I think it takes me time back to those days of loving quizzes on a Friday night watching the telly. I love to play your cards right. Okay, so let's have a little look at a quiz. So we've got a poll which we're going to launch, and we're going to get you thinking a little bit about health and well-being. So if you could launch the poll for us, fantastic. Thank you. Okay, so if you have a little look at this poll and have a go at answering the questions. It's a multiple choice, so it should be easier for a Friday morning. Sets us up for when we're having some of these quizzes on a Friday night, I think, doesn't it?
Sarah Brown was doing a quiz tonight, so a bit of practice.
Oh, a bit of practice,
yeah, a bit of practice.
Like, yeah. Okay. So I can't actually see kind of how we're doing in terms of people completing the quiz. So I don't know whether, Charlie, if you can let me know when we've had quite a lot of answers, that would be really helpful.
Yeah, of course. So we're 440 there, so halfway there.
Oh, okay, got another 40 to go.
You're up to 50. A little bit longer.
I'm always one of these people that completes it and then has to go back and check it again. I don't know if anyone else is like that. Change my mind.
Well, I've got the countdown thing coming on, which is do.
65.
Oh, well done.
Another minute, another 30 seconds.
Yeah, great, thank you.
I think sort of slowed down a little bit. I think most people have done it now.
Brilliant, thanks, Charlie.
That's fine. Shall we want to go through the answers?
Yeah, perfect. Thank you. Thanks everyone for taking part in that quiz. Okay. So if we go to the next slide, it's got our answers on. Thank you so much. Okay, so we've got the poll results here on screen. So first question, what was the average number of work days per case lost due to work-related anxiety and depression in Great Britain in 2019 and 20? That was 21.6. So nearly half of you got that correct, that answer. So that's research done by the Health and Safety Executive, and they published this research in November 2020. Okay, so that equates to 17.9 million working days lost, 17.9 million working days lost. And the rate of anxiety, stress and depression has increased in recent years. And as Juliet said at the start there, I should imagine over the last 12 months that has also had a massive impact on those figures as well. And stress, anxiety and depression is more prevalent in the health and social care sectors, as well as other public sectors such as education. So question 2 we had, what percentage of working days lost was due to stress, depression or anxiety in 2019-20 in Great Britain? Again, this was another HSE figure, and it was 55%. So over half of working days lost are due to stress, anxiety or depression in Great Britain in 2019-20. Okay, and Deloitte has found, they did some research in 2020 and they found that poor mental health is costing UK employers up to £45 billion each year, and this is a rise of 16% since 2016. So yeah, it's increasing, and the cost associated with absence are increasing as well. Okay, so question 3, we had, what were the top 2 factors causing work-related stress, depression or anxiety in Great Britain in 2019-2020? Again, this was from the HSE in 2020, and most of you got this correct. So workload pressure and lack of managerial support were the 2 main factors. And this has been backed up by research by the Chartered Institute of Personnel and Development, also in 2020 in their Health and Wellbeing survey. And they found the top 2 causes of stress was heavy workload and management style. In terms of the percentage of employees who felt their organisation supported their mental well-being in 2019-20, that was 43%. Okay, and in terms of the CEOs and people feeling that CEOs and boards were considerate of employee mental health and well-being in 2019-20 was 37%. And I just want to draw your attention, and they're both from business and the community, I just want to draw your attention to this final figure. It's something that I'm going to talk about in a bit more detail, was how many business leaders experienced poor mental health during the pandemic. And this is from research by Bupa, and they found it was actually 8 in 10 people experienced poor mental health during the pandemic. It was 8 in 10 people. Okay, so that's quite a significant amount, and there's not much research at all around how we can support leaders to lead while they themselves may be experiencing anxiety, depression and stress. So it's something we'll talk about a little bit later on. So I think these stats kind of give us a bit of background about why we're doing this workshop today. You know, there is a business case for kind of doing this in terms of cost, but there's a moral case as well in terms of anxiety, stress and depression disproportionately affecting the health and well-being of people who work in the health and social care sector. And so this is the aim of our today's session, really, to look at this in more detail and give you some hints and tips about how we can work together and hopefully, you know, help our cultures to be healthy cultures for people to work in. Okay, thank you. If we can move on. Over to Claire.
Hello, that's great stuff. Thank you for that, Louise. So I'm just going to talk a little bit about the business case. One of the things we talked about that we share is have a bit of a discussion about how we measure the success of our wellbeing activity in our organisations. And Louise has already referred to the Deloitte report, and what they found is that for every £1 spent by employers on mental health interventions, that actually you can get £5 back in things like reduced absence and presenteeism and staff turnover. So the business case is really, really clear in terms of that cost effectiveness. But we were just really curious to know about how you measure the cost effectiveness of your workplace wellbeing activity. And we're going to put us into breakout rooms in a moment just to have that discussion. But one thing that's really helpful, and I don't know whether anyone's come across this before, let me know in chat if you have, is the What Works Wellbeing Cost Effectiveness Calculator. What Works Wellbeing are a group of academics who work together virtually to look at the evidence base around wellbeing interventions to explore what works in terms of employee wellbeing. And led by Bryce et al., they've developed a cost effectiveness calculator, which is an estimation of how much an intervention, a wellbeing intervention, costs relative to how effective it is in improving wellbeing. And the way they measure wellbeing, one of the recommended ways of measuring wellbeing is to measure life satisfaction. Now on the website, they've got the cost effectiveness calculator and it's free to use. It's an Excel spreadsheet. And it also has like a guidance manual with it as well. And it also has the measures in there that you can use, for example, the life satisfaction question. So we will circulate the slides and the link to that will be on those at the end as well. So you'll be able to have a little go at that if you want to. But if you could just move the slide on for me, Casey or Charlie, thank you. So in order to complete the cost effectiveness calculator, the type of information that you need is the number of participants who've took part in a health and wellbeing intervention and their salary or hourly pay level. And then you also need, if it's a workshop, the number of facilitators and their salary or hourly pay. And then you also need to know some other additional costs. So if it's, it's a workshop, you might produce some workbooks. There might be venue costs. If it's an application, there might be design costs. So you can add all them into the calculator. And also, they also recommend that you have some measure of productivity as well. So, for example, sickness absence days. So you'd have a measure of that before people took part in the intervention and also afterwards. And then they recommend you measure participants' well-being before and after the intervention as well. And the life satisfaction is one example. So long as you've got that information, then you can complete the calculator. Now, what they recommend is that you do the calculation a year after you've completed the intervention. And they also recommend that you try to compare against a control group. So you might have one group of people who, for example, have took part in a workshop and another group who haven't, and you compare them. So you have a control group. And they also recommend that the participant group size is 50 or more. Now, you don't need to have a control group and you don't need to have 50 people. It's just that the results are more robust if you do have that in place. So you can see the little picture to the right of the slide, a little demo. So I've had a little calculation of my masterclass in health and fitness application. And you can see there it's estimated that my application costs £37.02 to improve the life satisfaction of one person per point per year. And that they say that this is below the threshold of £2,500. So therefore, my intervention is cost effective. So where they get that idea about the £2,500 is that actually they've looked at NICE guidance. And what the NICE guidance actually says is that a treatment is cost effective if the benefits of an extra year of life in perfect health cost less than £25,000. So rather than calculating the cost of an extra year of life, what they do is they calculate the cost of a 1-point increase in life satisfaction per person per year. So that's what the calculator does. So I'm just going to show you now what the Excel spreadsheet looks like, just so you can have a little look. And then I won't take you through the whole lot of it, but at least you've got a bit of an idea about how to fill it in if you do want to have a go after today. So let's see if we can do this. So hopefully you can see that on the screen now. Yeah, brilliant. So you just basically, you literally click the start button and it takes you through all of the questions that we've just talked through. So you put your name of your intervention in, your participants, etc., and it just takes you through those questions and it populates the left-hand side here of the Excel spreadsheet. So you can see here, I've got the masterclass in health and fitness app. I've got 12 people in there, no control group. And it populates all the information, and then you get to this bit here and it says that really my intervention is cost effective because cost per 1 point improvement in life satisfaction per person per year is only £37.02. So therefore it costs less than the £2,500 benchmark that they've set using the NICE guidance. So that's something that you can just use for free. It produces a graph as well, and it also gives you a look at how much you save over a year of a person's life as well. So that's there for you to have a little look at. As I say, if we can just put the slides back, that'd be great. We'll share that link with people afterwards. Is anyone familiar with this cost effectiveness calculator? In chat, if you just want to let us know if anyone's come across it before. Not so far.
No, not seeing any. Are there any other tools that people use? Anyone can pop that into chat. It'd be interesting to understand. Oh, okay, so Sharon, never seen it before. No, so it's really interesting. It's seen it but not used it. Oh, okay, Nikki, thank you. Nikki, I'd appreciate you would. No, I've used a cost benefits analysis. Oh, that's interesting, Ruth.
Great.
Not this. Yeah, it's interesting, isn't it? Because I'm sure there are other tools out there that really can help with this, and often it's about being able to find it and think about best way to use it. Yeah,
I think Jude, I might use a scale of feeling before or after. I think, yeah, really great. So I know that when Sue and I did a piece of work with the Manchester Health and Wellbeing Board, and we worked with their member organisations, and some of those were using, I think it was the general health questionnaire, pre and post mindfulness course, to look at the impact that it was having. So things like that's really helpful as well. So, okay, well, let's carry on this conversation in your breakout group. So what we'd like to do is just put you into breakout room, and we'd like you to discuss how you are, or how does your organisation measure the impact of their approach to health and wellbeing. And it may be that you've got an example of an intervention that you've used in your organisation and you've measured its effectiveness, and that's what we're really interested in. So what interventions are you using, and how have you measured them to know that they're benefiting people who you work with in terms of their wellbeing? So we're going to put you into breakout rooms for 10 minutes, and if you can just be ready, just when you come back, for one person per group, to just share in chat an example of an intervention and some of the metrics to use to measure impact. That would be great. Lovely. Well, welcome back, everyone, and thanks for going in the breakout rooms and having your discussions. So just in chat, if you'd just like to put, what health and wellbeing interventions you've been using and what impact they've had and how do you know, that would be fantastic, just so we can share some of the learning about some of the interventions that work, and how you measure that impact. So if you'd like to just start populating the chat, that would be great. I know just before we went into the breakout rooms, Jill Fazy there made a great point about demonstrating cost effectiveness is something she feels like we will need to focus on. The business case is obvious at the moment, but actually, as we kind of go through the coming years and months, how will we continue to show that impact? Okay, Alison, yeah, so solution groups and feedback machines. Oh, great. What's a feedback machine?
Yeah, I was looking at that.
Yeah, this is. I've mentioned this quite a few times, so I think if Jill and Lisa are on, they'll hear this a million times. We got some machines. We leased 3 feedback machines, and we used the NHS employers. How are you feeling today? With the 3 faces, and they would go around sort of certain areas for like 5 or 6 weeks. And we'd say to the staff, we want you to, press the faces a couple of times a day. And then I would go onto a platform and I could pull the data down. So I could even say, for instance, on a Tuesday at 2 o'clock in maternity, everyone's pressing red. What's happening on Tuesday at 2 o'clock in maternity for everything to do that. So then we would go in and say, like, that these are your results over the 6 weeks. What top 3 things would make you press the red face? And they would come up with their top 3 things. And then we would say, right, okay, so what is your solutions to these top 3 issues? And then they would come up with their own solutions to, I suppose like team coaching type of thing, really. They would come up with their own solutions to their own issues. And then we go back in, after a couple of months or so and say, right, okay, this is what you said. This is what you said you were going to do. How's it going? And that's the type of thing that we've been doing.
Yeah, wow. So real-time feedback.
Yeah.
And actually you can address it really quickly then, can't you?
Yeah.
That's really good. I suppose I've never seen that before, Alison, in a hospital setting. I've seen it in an airport, where
bonkers idea. We've just got 3 more, actually. We've just got at least 3 more machines that are asking questions about COVID, and we can change the questions. We didn't know we could change the questions, but we can. So these are going round now at the moment around COVID and finding out what everybody thinks how the trust has performed during COVID. We're looking at social distancing, masks, work-life balance, all sorts of things like that. So we're just getting that data in, and then we'll change the question, send it round again, and then at least they've got that data there that they can work with. And that's the way we're doing it, as well as the pulse surveys that we're doing, and as well as staff surveys and sort of staff walkabouts, staff supporter walkabouts. So we're getting that qualitative information as well.
That's great. Which organisation are you in, Alison?
Liverpool Women's.
There you go. So if anyone wants to get in touch about these machines, these feedback machines.
Yeah, people always say they want information, and people, I always wait for people to email me, but no, happy to do that. Happy to give anybody information.
Thanks a lot. That's brilliant. Thanks, Alison. So we've had a lot of feedback, which is great, from in the chat as well. So people are talking about staff surveys and staff supporters asking real questions. So are they people inside your organisations who are going out and talking to people on a regular basis? That was Jackie. I don't know whether Jackie's still there.
Yes, I was part of the group with Alison. It was Alison's contribution. This was part of the regular strategies that they have people wondering about, and not just saying, are you okay, are you feeling well, how are you really, kind of where are you, sort of thing. So I felt really, really useful information.
Brilliant. Yeah, thank you, Jackie. That's great. And that being able to ask how are you, but ask it more than once actually is really important, isn't it? I think there was a recent programme, wasn't it, with Roman Kemp talking about his mental health and his friends. And yeah, they were talking about that asking several times how people really are and being really interested. So lots of great things and many interventions. Health and Wellbeing Ambassadors, that's Steve. Steve's got help. Steve, tell us a little bit about more about your Health and Wellbeing Ambassadors.
Yeah, we introduced the Health and Wellbeing Ambassadors just over 18 months ago now. It's something that we're expanding. We would have expanded sooner, but there's been, because of the pandemic, it slowed things down a bit. I think one of the things that we concentrate a lot on interventions and putting interventions into place, but we don't measure the impact and the effect of those very effectively. And that's something we're looking at moving forward. The usual measure that used is, has absence reduced? Yeah. And at the moment, absence has reduced, but a lot of that is down to presenteeism and leavism over the last 12 months. So we need more effective and holistic measures for how effective the interventions are.
Yeah, great. Yeah. So some of the wellbeing metrics that we're going to talk about in a moment might be quite helpful, Steve, for some of that. Yeah, so that's really helpful. Thank you for that. I think a few other people have said, Steve, similarly, that actually we've got interventions in place, but we're not necessarily as smart at measuring the impact that they're having. So Sharon says they're serving everyone using the WHO index, the World Health Organization index, on a monthly basis. Sharon, tell us a bit more about that. That's Sharon.
Yeah, hi, sorry, I was just I was on mute. I can't believe I owned up to that. Yeah, so we as part of our measure, we've been sending out the WHO index, which is, it's only 6 questions. It's a trust that has 20,000 staff. So what we do is we send it to a quarter of the staff every week. So over a month, we've covered every member of staff. And that gives us a score and a sense check around how the organisation is feeling, really. And then we can target specific health and wellbeing programmes to the results of that. So, for example, last month there was a particular change in how people were sleeping, so we did some comms and some signposting to apps and to websites and things, and self-help guides, etc., and how they can improve the sleep. Mm-hmm. So that's, and then that feeds into a wellbeing dashboard that we have, which collates loads of information from MSK data to sickness data to absence and leavers, etc. So yeah.
Brilliant, thank you, Sharon. That's really good. So again, what's great is the immediacy of the results that you're getting. So you're finding out and then you're being able to act quickly based on the results, which is really great. So thanks for that, Sharon. So thank you. I can't pick up all the comments in the chat box, but that's really, really helpful. So thank you for that. So if we just go on to the next slide, if that's okay, Casey, Charlie, that's great. So we've talked about measuring impact. One of the things that Sue Louise and I did, we've been working recently with the NHS Northwest Leadership Academy on looking at healthy leadership behaviours. And Sue's going to talk a little bit more about that in a moment. But one of the things we did is we did a review of the literature, of the academic and the practitioner literature as part of that project. And we started to look at, okay, well, what interventions have got a strong evidence base behind them? And there is increasingly more and more evidence that's being published about what types of interventions work. Now, this literature review was done probably back in July, August last year, so there may well be more evidence out now. But the type of things that we found, and we've just split them up here into individual and team on one side of the slide and organisational. So the types of individual interventions which we know have a robust evidence base are things like mindfulness training. Also, training to help people to deal with stress, so to develop the coping strategies to deal with stress are also effective. And at a team level, it's things like training team leaders to be able to foster team cohesion, so connect with a sense of purpose, to support teams to develop psychological safety within the teams. And Amy Edmondson talks a lot about that, and Michael West does. And also ensuring that within teams, everyone knows what they're doing, so everyone's clear on expectations. So team training can be really helpful. And then some of the things at an organisational level are things like timely access to face-to-face physio, early access to telephone helplines around sickness absence, so people can get quick access to interventions when they need them. And I think the one at the bottom of the slide on the right there is really important. Mental health interventions thought to be helpful include those which focus on the wide aspects of work as well. So things like financial health, things like that, people worry about that. That can be a real trigger for people. Things like thinking about team interactions. But what this study found in particular was actually focusing on interventions that people actually want and think will be effective. And that kind of really links in with what you've been saying, is we've been checking what people want and need, and we've been putting that in place, which is fantastic. So yeah, Alison, we can share the slides. Yeah, absolutely. Yeah. So this is just, and this evidence base that we've reviewed is part of a flipping book as well. Got to be careful how I say that. That the NHS North West Leadership Academy have now published, and Suzanne Douglas, I think, is on the call as well today. So she's going to be able to tell you a little bit more about that a little bit at the end of today as well. So, but we will share the slides. So we can move to the next slide if that's okay. So we've talked a little bit about this, measuring your approach. So thanks, Jill. Jill's put the link to the flipping book in chat. So there's loads and loads of ways of measuring your approach to the success of your interventions. These that I've popped onto this slide have been taken from a question bank on the What Works Wellbeing website. So they've basically done some work. They've looked at different metrics, and they've said these ones are helpful because these have got benchmarks with them. So there's benchmarking data behind all these questions, and they're taken from the ONS survey, Office for National Statistics. So the first four there are a measure of subjective wellbeing. You can use them as a collective of four. You can see there's the how satisfied are you at life nowadays, etc. Now you may well have some of these already built into your pulse surveys, your questionnaires. So for example, I would recommend my organisation as a great place to work. I think is a standard pulse survey question. But the good thing is, and I'm sure you're already doing this, and I know if you do the staff survey in the NHS in particular, that you will have benchmark data to compare yourself against previous years and other trusts of a similar nature. This is also this has data which compare you to the general population. So if you just move on a slide for me, I'll just give you an example from the life satisfaction question. So this is just an example. So UK population had a mean score of 7.69 in life satisfaction in September 2019, and that's in the ONS survey. So if you use those questions, you compare yourself to the UK population, if that's helpful, and then it just gives you a breakdown of the different score ranges there as well. So What Works Wellbeing is a great resource. Their website, they have loads of free stuff on there. So they're great for looking at the evidence base, looking at interventions that work, looking at the cost effectiveness calculator, and looking at different metrics you can build into your own pulse surveys or your feedback machines if you've got them. So that's great. So what I'm going to do now is I am going to hand over to Louise, and she's going to talk a little bit more now about the role of our leaders and in supporting employee health and wellbeing at work. And just before I hand over to Lou, it was really interesting. I was on a call last night with Professor Kerry Cooper and Lennart Levi, and they were talking as part of the International Stress Management Association webinar. And Kerry Cooper was talking about some of the recent leadership examples that we've been seeing in the media, which I thought was really interesting to think about how as leaders we create the culture to support people's well-being, and actually how we role model as well as leaders. So I'm sure that you've all read in the news examples such as Goldman Sachs. Their chief executive is asking people to go straight back to the office as soon as they can, and we heard reports of 80-90 hour working weeks as well. And then conversely, we saw yesterday the chief executive from Nationwide saying, well, we've listened to our staff, and 57% of our staff are saying they would like more flexibility about how they work, so we're going to let people work from anywhere. So real examples of two different leaders taking very different approaches in terms of creating that health and wellbeing culture. And then we've got great examples such as the chief executive of BP, Bernard Looney, and what he's done is he's been really open about his mental health, and he's enabled other people inside his organisation to start to talk about that. Another example, the Norwegian Prime Minister was really honest about his struggles as well with depression, and took some time out and came back, and he got an outpouring of support from his population, from the country. So how do we help people to start to talk about these things? And Louise is going to talk a little bit more about that now. So I'm just going to hand over to Louise.
Thanks very much, Claire. As the figures shown earlier on in the quiz, 8 out of 10 business leaders have experienced poor mental health at some point over the last 12 months during the pandemic. But even before that, I was quite interested to see what there was around research around actually what happens if leaders actually experience poor mental health. How can we support leaders? And I came across some research, really good research, which is still underway by Dr. Sally Maitlis, who's a professor at Oxford University. And as you can see on the slide there, what she was finding is that despite the prevalence of mental health problems in the working population and the magnitude of the difficulties that they cause, there's almost no research on leading with mental health conditions. And so this is something that Sally is currently doing some research around. And this is an area that I feel particularly passionate about. I remember when I was a senior leader, and I remember feeling a huge sense of responsibility to, really support my team to look after their health and well-being. And I also remember, whilst the time in a senior leadership position, experiencing what I later became to understand to be the symptoms of anxiety and depression. And at the time, I remember thinking it was just part and parcel of the job of being a senior leader. This is kind of just what we experience in these senior leadership positions. And it wasn't until I actually broke down really, and I ended up resigning from my job as a managing director, that I realised that what I was experiencing, was actually symptoms of mental ill health. And by this point, the toll on me personally was quite substantial, really. And so when I kind of came across this research from Sally, I was really interested to hear about how other leaders experience mental health in the workplace. And I think one of the things that I noticed in myself is I threw myself more into work. As I began to experience those symptoms, I threw myself more into work, and it was almost becoming like a vicious cycle. And so reading Sally's research, it was almost like a bit of a light bulb moment for me, because actually I thought, well, I'm not alone here, and other people have experienced similar. So as I say, Sally's research is still ongoing, but she has actually shared some of the initial kind of findings of her research so far. And what she's finding is that she's suggesting senior leaders may experience mental ill health differently from others at work. And what she suggests is when they experience anxiety and depression, they focus more intensely on their work as a way of almost coping or kind of ignoring the problem, really. And this can temporarily make them feel better. And it's only kind of when they stop work do they kind of then feel those symptoms again of anxiety and depression. And so leaders can almost kind of disconnect from their emotional experiences through this kind of cycle. And what she suggested, the interplay between the feelings of anxiety, the concealing it from other people and themselves to some extent, the losing yourself in work and carrying on working builds pressure in the individual. And what she found is it's not until people have some kind of revelatory experience, such as a relationship breakdown, a panic attack, or, actually keeling over, that they kind of become aware of the problem, as it were. And so it's almost like people have to have this shocking experience to break this cycle that people are finding themselves in. And so what she's looked at is what people then do in terms of once that cycle's been broke, what do leaders then do in terms of changing the way that they live and lead? And what she's found is actually that actually they start to think about the schedules more. They think about, how can I change my schedule so it's not all work? So if people are starting at 7 o'clock in the morning, they're not then going on and doing all the nighttime meetings, so they'll start later. She's found that they're building in time for relaxation and reflection and being kind to themselves. She's also finding that these leaders who have experienced these symptoms also recognise the signs more than themselves and in other people. And that's leading them to lead with more empathy and more compassion. And also she's found that people are really aware of building a support network, and that's really important to support them in the future if they feel those signs and symptoms again. And at a macro level, some of the things that Sally's suggestion is to break this cycle. What we need to do with our senior leaders is to educate and train them and talk more about mental health, and, you know, give them kind of, you know, the courage to actually open up and talk about it too, and the support to encourage people to open up and talk about it. And one of the things she also talks about is let's rethink the definition of what successful leadership is. So a definition of successful leadership is not wearing long hours as a badge of honour. We, in the healthy leadership framework, there's some really good examples of how leaders can lead to create a healthy workplace. She's also suggested let's make health and wellbeing and mental health and wellbeing absolutely central to our leadership development. I don't know about anyone else, but I've never really been on a leadership development course where health and wellbeing has been the central part of that training, and it's so important. And also, finally, she talks about the importance of sharing stories. People, like Claire said, see leaders, you know, sharing their stories about, you know, the impact of mental ill health on them, giving people support and encouraging others to be able to open up and talk about their own mental well-being. So lots of good indications of what's coming out of that research. It's still ongoing, and there's a link at the end of these slides to a short film where she talks about her research, which we'll send you. But it's definitely one area to keep an eye out on, and it's definitely something that I think we all need to think about more, and think about what more we can do to support senior leaders. Okay, I think I'm over to Sue now. Thank you.
Thank you. Thanks, Lou. And I'm just looking at what's going on in chat. I mean, it feels like it's on fire in there. So many good ideas, so many things to share with each other, some great potential for case studies. And I'm really mindful that Northwest Leadership Academy and the Collaborative and NHS England Eye are all looking for examples of where this stuff is working really well in organisations around interventions, but also gaining a bit of insight into things that would really help organisations to focus on health and wellbeing. And great there, Lou, thank you for sharing your personal story. I think that's been really appreciated by many in the audience. And interestingly, I was reading an article last night. It feels like that's all we do is read articles about health and wellbeing, steeped in it. But it was from McKinsey, and I don't know if any of you sign up to McKinsey. They again have quite a lot of interesting articles that are from across sectors, not obviously just health and care. And there's a report or sharing in there from Anastasia Hinster, who is a chief executive, who's identified that wellbeing improves performance in teams. Having that as central and core, as Lou was suggesting, actually helps to improve team performance. It should be the core from where you come from, not an afterthought. And I think that's something that all of you will absolutely get and appreciate. So on the basis of that, and knowing that there's so much knowledge and insight in this particular group, and we're all learning from each other, which is fantastic, I think we can all sort of tread the path together to become a health and wellbeing ninja. And this is something that myself, Claire and Lou have coined as a way to think about how we want to be, how we want to work with organisations around health and wellbeing. And this is about a person or people that excel in a particular skill or activity, to really take it to the next level. And we've got lots of evidence of that happening right here and right now, which is fantastic. So in the next 40 minutes, I'm going to hold the process a little bit more around helping you to share and explore your own strategies and approaches that you use as a leader and as a team member within your organisation. Also, I'll give you a bit of an overview in more depth about the Healthy Leadership Framework and basically how that was developed over time, and both Claire and Lou have already given a little bit of insight into that. Then I'll take you to the framework itself, so you can see the behaviours that we've pulled from the evidence base and also tested out through our approach to developing the framework. And then interestingly for us, we thought there'd be quite a helpful conversation to have around think about health and wellbeing guardians within organisation. What is their role? What's their position? Because this is still new and being formed to a certain extent, although some organisations are further ahead than others. But there's definitely something about how can that be capitalised and really help organisations, teams, to really embed a culture of health and wellbeing. So what we're going to invite you to do, because I'm sure you're all sort of full of information and full of ideas, we're going to give you an opportunity now to go into some breakout rooms for about 10 minutes. And what we'd like you to do is to think about, as a leader, what helps you to attend to your health and well-being. So this is all back to the principle of you first. What are you doing? So listening to Lou's story about how people just carry this stuff around, don't even notice the cycle they're in. What is it you do around that? And what do you do as a team? So in the teams that you're working in, how do you collectively think about your health and well-being? Because it's so easy to get focused on tasks in your busy day jobs and lives, that just stepping back and thinking, how are we doing some of those basic check-ins. So again, how do you do that within the team context? So I think Charlie or Casey will be popping you back into breakout rooms. So we're going to give you 10 minutes, and if you can come back just to prepare, just be prepared again to share just 1 or 2 tips or thoughts from your group, that would be fantastic. So Casey or Charlie, are we all good to go? So the invite to the breakout rooms will come shortly, and if you can accept that, that'd be great. If you need to take a little bit of a comfort break, by all means do. We need to think of your health and well-being. And facilitators, if you can not accept, that'd be great. Oh, here we go. Woo! It's like waterfall, isn't it? Everyone at the same time. Brilliant, lovely, fantastic. Great to see you all back. And of course, like a lot of these things, you know, there's a term, isn't there, sort of unconference, which is where people go and have conversations, and that's where they do the majority of their learning. But I think what's been fabulous about this morning so far is we were just reflecting as you're in your breakout rooms, the learning and the sharing that's going on is phenomenal. And we will make sure that you get the slides, the links. Somebody asked for the McKinsey article, I've popped that into chat, but you know, fear not, we will gather this stuff together. And as you know, I'm sure you know, colleagues from the collaborative and nationally will be really interested to sort of pull out from the information you've shared already and possibly follow it up for some great case studies. I think there's plenty there to go at. So really good. So you had an opportunity for you to have conversations about, you know, how you attend to your own health and well-being. So, you know, that whole thing about model it here, start with you is really, really important. And I'm hoping now that you can maybe start to share some of those ways that you do that in chat, because that may well inspire other people to sort of think, oh, do you know what, I might give that a go as well. And we also asked you to think about, as a member of the team, how you go about holding those conversations and encouraging people to think about their health and well-being. Again, are there tactics, approaches, or ways that you do that you're willing to share that would really help other people maybe again to think about, how do I go about doing some of this stuff, or how can I bring those ideas into the organisation or into teams I work with. So just starting to see 1 or 2 ideas, perhaps. Oh, goodness, yeah, cold water swimming booth. This really seems to be taking off, and wild swimming is something really taking off at the moment. And again, the impact that it seems to have on people's metabolism and, you know, just the mental well-being seems to be having, there's quite a lot being written about that at the moment, so really interesting. Charlotte talks about walking and blogging and reading. My goodness, yeah, do you know, sometimes some of the easy accessible things to do, and, you know, finding ways to build that into your day so that you get the opportunity to do that. Oh, great. So actively using the 5 ways to wellbeing, brilliant. You know, certainly myself, Lou and Claire and I talk about that a lot. We apply those to ourselves to think about, are we doing the 5 ways to wellbeing, and we bring that into our conversations with teams and with coaching clients. Time with family, my goodness, yeah. And it's so easy, isn't it, to be so focused on things in front and the importance of connections and relationships and, you know, making time to be with loved ones in whatever capacity. And of course, during COVID, that's been problematic for various reasons. And, you know, hoping that people here have had the opportunity to find ways to connect with loved ones, you know, near and far away via whatever mechanisms they can. Yeah, lovely. Coaching and receiving coaching, and you know, whatever capacity you're in, finding that safe space to be able to download, to reflect, to decant is really important for individuals and teams. And Michael West talks a lot about reflexivity, and it's one of the things that really helps teams to learn and to perform better. So bringing in reflective processes is really essential, so can't be understated enough, and finding ways to do that. Not afraid to check in with leaders, absolutely, my goodness, you know. So it's funny, isn't it, we're in a, you know, sort of often in organisations we're in this hierarchy, and there's an assumption that, as Lou was saying earlier, you know, there's this sort of protective mechanism I think many people put on, and a requirement to look like you're okay and coping. And actually, you know, stress and anxiety and poor mental health can come to anybody, whatever your role. So checking in with leaders as well, you know, not allowing it just to be a one-way thing, but making it part of what we do as human beings at a very human level. So some great stuff here. Self-appreciation as well as gratitude, absolutely, you know. And gosh, don't we give ourselves a hard time? Our greatest critics are ourselves quite often, but actually sometimes we just need to go, do you know what, I'm doing the best I can with the resources that I have, and just, you know, again, being compassionate and kind to self, in an effort to learn and grow from that position. Yeah, some great stuff there. So not being afraid to challenge. Oh my God, I just saw flitting up there, recognising imposter syndrome. My God, yes, I could write a book. I'm sure many of us here could. And it's really common, so common. And I think that's something we perhaps underestimate. So when we see people looking really confident, actually sometimes underneath that lovely analogy of, you know, on the surface there is this one, but underneath the legs are going like mad, are real truisms. I can confess to that today. So, you know, whilst I might look fine on the surface here, yeah, my legs were absolutely going this morning. So yeah, so great, thank you. So yeah, so keep those ideas coming, and we will capture those, because it's really important to be able to pull this wealth of insight together. So thank you for that. So what I'm going to do now is just ask Charlie to pop the slides back up, if that's okay, so we can just continue to navigate our way through the rest of this session. Lovely, brilliant, thank you. Okay, so if we could just move on, Charlie, that'd be great. So what I'm going to do now is just share a little bit more about the work that myself, Claire and Lou and I did, myself and I apparently, so I did with the Northwest Leadership Academy. And as Claire highlighted earlier, this was sort of a building up from work we started off in Manchester back in 16-17. And we really began to galvanise our thinking around how we support organisations to think about health and wellbeing more strategically, how they do some of that benchmarking, how they do some of the evaluation around the things that have impact and work. So we were building up a body of knowledge. And then we were invited to put in a proposal around looking at healthy leadership, which really touched so many of our areas of passion. We felt that we really wanted to put ourselves in the frame for that, and we were successful in the process, which was absolutely fantastic. And it just so happened, coincidentally, it was just prior to the COVID pandemic really taking a grip. It was already starting to bubble away, I think, just at the point we were being asked to do the work, but just at the point we were appointed, actually it was just taking a grip at that point, and we had no idea that the work we were going to be doing would be so instrumental in our thinking over the last 12 months, and certainly today and moving forward. So we feel very fortunate to have been able to do that work, because we were able to connect with many people with lots of expertise and experience and insights, from across health and social care and academia, etc. So I'll just talk you through a little bit more about that. So in effect, we were commissioned back in March last year, but we actually started the work probably around about June time. And the scope of the work really was to develop 3 outputs. The first was to review the academic and practitioner literature to really get a sense of what healthy leadership behaviours looked like. So what could we draw from that had all been written about and researched. Then using that evidence then to convert into a framework that actually identified those healthy leadership behaviours. And then making sure that we were able to sense check and make sure that they landed well across health and social care, to help leaders and individuals and teams and organisations be able to get a sense of what good looked like. And then from that, then the Commission also involved us providing some recommendations to the North West Leadership Academy, which was for them to help them with their health and wellbeing strategy to support leaders across the system. But also within that, we made some suggestions about things that leaders and managers would need to take into account at a personal level, because we felt, well, we've done the work, it can't just be about recommendations for the Academy. It probably also needed to maybe point some areas out that, you know, back in practice that leaders and managers could also take into account. So the process was, we spent a couple of months looking at the evidence base from academic and practitioner literature, and there was a wealth of evidence out there, I have to say. So we had quite a narrow focus to really draw in, looking at healthy leadership behaviours, what that looked like, and how they were described, so that we could draw those out. We were able then to draw out, I think it was over 100 leadership behaviours that were behaviours that either enabled healthy leadership in the workplace or detracted from healthy leadership behaviour in the workplace. And we looked at both positive and negative, because we felt it was really helpful for people to understand what good looked like, as well as what are some of the things that might, you know, take away from the culture in order to help people to be able to be healthy, well, and in work. So once we'd gone through the literature, we pulled out those behaviours, and then we took those behaviours, and what we began to do then, in addition to that, was to conduct a number of one-to-one interviews, again, from people from across health and social care. And actually it was Louise who conducted those interviews and really pulled together a fantastic body of knowledge about the experience of individuals from diagonally sectored across the organisation. So not just leaders and middle managers, but also practitioners from the front line. So we've got a really broad spectrum of insights from, so what does healthy leadership look like? What does it mean to you? What helps in the workplace? What detracts from the workplace? So again, able just to pull that in, that really helped us then to sense check the evidence base we were able to pull from the literature. So combining those two things together, what we then did was to take that out into the social media world. So we had great fun using Twitter with the North West Leadership Academy team. I think it was definitely a school day for me when they showed us this is what you can do with social media, and it was amazing. So we were able to sort of involve and engage a whole spectrum of people to say, from all walks of life, to say, this is what we're pulling from the evidence. What do you think healthy leadership looks like? Here are some behaviours that we've identified. What really resonates for you? What do you see as the top 5 behaviours that you would want to see in the workplace that would really help to enhance health and well-being? And what are some of the behaviours that also detract? So we carried on with that theme all the way through. So then, following on from the social media campaign, we then took it into some focus groups. And actually many of you here were involved in those focus groups, so thank you so much for that, because what you were able then to help us to do was to help us to really refine the framework and help us with the language as well, so that we were able to come up with 3 clusters of behaviours, or sort of 3 clusters of behavioural elements, and then sense check the more detailed behaviours underneath to make sure that the language was clear and accessible to all. So that was fantastic work for us, because I think in our experience sometimes we look at frameworks, they can be slightly jargonistic if you're not careful, or can feel too sector specific. So because we had that breadth of people involved, it really helped us to keep it as accessible, we think, as it possibly can be. So once we developed the competencies, then we compiled the report together, and that's when we made some recommendations to the Leadership Academy, and they're planning to share those more broadly and widely with you over the coming weeks and months. So thank you. If we can just move on. So what we're going to show you now is the first of 3 clusters. So the 3 clusters are how I am, which is me, start with me, how I am as an individual, as a leader within an organisation, a leader across teams. Then the next one is, oh, I've had a memory lapse. There we are. What I do, if I haven't got it in front of me. So how I am, what I do. So then it's what do I do when I'm working with others as a leader to make sure that I embed health and positive and healthy leadership behaviours, and also then focusing on teams. So what do we do together? So it takes it from the individual to the leader to the team. We felt that was quite neat in terms of thinking about the process to make it tangible and realistic to people. Of course, we could take it further out into the organisation, but I think that then becomes quite complicated. So we want to keep it quite bounded so that people could access it easily. So the first cluster we have here is how I am. And again, to the left, you'll see these are the positive behaviours, about actively engaging with opportunities to understand, enhance positive mental and physical health for self and others, sharing your own experience and being authentic. So many of you will look at those behaviours and think, oh, well, there could be more there. But the 5 that are here were the ones that topped the poll. So when we did the social media, we said, what are the top 5? And these came out of the top 5. There are more, which you could access and could be made available to you. But we felt, well, we needed to frame it in some way. So again, no surprises, I guess, based on what you're already sharing with us about being a good health and wellbeing role model. So walking the talk, so doing it yourself, showing vulnerability and humility when you don't get it quite right, and maybe things haven't landed quite well, being able to be open and honest about that. And by doing that, then creating that psychological safety for others to be able to do the same. And then on the right-hand side, you've got the behaviours, if you just go back, on the right-hand side, you've got the behaviours that can detract from the sorts of things that you might see in yourself, maybe some signals to you about when you need to start to check in and think, what's going on for me right now? So do you notice yourself maybe not being as empathetic, or actually starting to notice yourself being distant? So you've got both sides. You can get a picture for yourself about your best self, but also some of the things that might begin to be displayed when you're under stress and when you're under pressure. And again, within teams, you can start to talk about how you can feed this back to each other, which might be a really useful process to go through. Then if we move on to the next cluster, this is about what I do. So what I do as a leader, or what I do as an individual when I'm working with colleagues, or even again, you can apply this in other settings as well. So again, the same sort of process here. On the left-hand side, you have the positive behaviours that you would expect to see in this context, and on the right-hand side, those behaviours that might detract from health and well-being. So again, creating a situation where individuals, you're able to help people to take autonomy and control and have responsibility, to tackle bullying and inappropriate behaviour when you spot it. So doing it in the here and now, and not allowing that to go without being checked. And then on the right hand side, you might start looking out at what happens when I'm working with people. Am I focusing on targets all the time and maybe not checking in with them about how they are, how they really are, and how are they really, so all those things that we started to talk about. So again, this just gives you a flavour of how you need to be when you're leading with others. And then if we go to the next cluster, this focuses on what we do together. And again, we're really passionate about helping teams to really check in with each other about doing this work. So again, it's about being able to determine between all of you about how you can actively empower, be inclusive around developing a health and wellbeing culture that helps everyone bring their full selves to work so they can do the best job that they can under the difficult circumstances that often people face. And then on the right hand side there is a nice little checklist there again around behaviours. So when you're with the team, are we starting to see some of these behaviours coming through, and how can we have a conversation about what can we do to try and help each other to attend to maybe some underlying well-being needs or behaviours that maybe aren't being attended to fully. So those are the three cluster areas that make up the framework. And if we could just move on to the next slide. What we'd really like to do is to really get a sense from you about, now that you've seen the framework, how might you be able to use this? So we're going to give you, I'm just checking on time, we'll probably just give you probably just 5 minute, I think, yeah, we were being ambitious. So we'll just give you maybe 5 minutes in your breakout rooms to discuss how you could use the frameworks with individuals or teams or in your organisations. The focus groups and social media gave some great ideas already, but we think you will have more. So what we'd like you to do now is if we could put you into those focus groups just for 5 minutes into your breakout rooms, and just come back being prepared again as you have all morning to be able to share an idea about how this could be embedded either at an individual level or a team level or organisational level. So thank you. Are we all right to pop people into rooms, Casey? So you'll get an invite if you can accept the invite. Thanks, Lisa. I can see some people needing to leave, so thank you for letting us know. So if you can take your invite, that's great. And talking of sharing, lovely to have everybody back again. Brilliant. So thank you, everybody. We're really interested to hear some of your ideas. If you can pop them into chat about how you think this framework could help you, could help teams that you work with, could help, you know, sort of build up something within the organisation, how you see it could be used. I will share some ideas that came out from the focus groups because I think that they were really solid and they form part of the recommendations that went into the academy. So if we can just have a few of your ideas, that would be amazing. And we're going to shortly go into one more breakout, and we are going to mix you up a little bit so that you are with different people. So somebody requested that, and I'm very happy to do that. So let's get the hotline going. Appreciate some of you do need to leave, so thank you for letting us know. Thank you, and it's just fantastic to have you here. Oh, Sue's asked a really interesting question. How does this sit with the culture camp? So I'm just wondering, Sue, can you just tell us a little bit more about that, if you're able to just pop in?
Yeah, sorry. So Juliet's on this as well, actually. So she may actually be.
Oh, sorry.
So this week, the Innovation Agency hosted a 2-day culture camp, and very much kind of what came up from that, some of the discussions around health and wellbeing were around leadership. And Joe Rafferty in particular was talking about we can't have any more heroic leadership. So there's something about leadership per se, and there's something about some of the other skills around leadership within the framework. So I think it's just, it's not an either or from kind of the 2 days that I spent, which was great. And this is really good. There's just so much there that's really needed, and it's how you make sense of it. And how people can use it. So Juliet might want to say more about that, but it just felt two conversations about similar things.
Yeah, I was going to say, is it just for expediency of time, etc.? Is there another way to engage people, maybe in a bit more of that information? Is there a link you can share with us? Is there any?
Juliet probably is best to say that.
Great. Okay.
Yeah. So I'll we're pulling together all the materials from that, so we'll share that event. It was fortuitous that it all landed in the same week. It wasn't planned that way, I have to say. So, but it does all link together. And I just really quickly say that you know, culture, well-being, innovation and equity, you know, they're all sort of founded in the same, they're all sort of built in the same factory, if you like. You can't do one without the other, I think, and that was my takeaways from the culture camp, and then from what I'm hearing today.
Yeah, no, that's great. Thank you, Julia. And certainly in our conversations with Suzanne and the Northwest Leadership Academy team, we're really mindful that exactly that there's so much out there. And Suzanne was talking about, you know, being able to develop a little bit of a map and connections, you know, as part of this process and ongoing work to help people to find a pathway through, because there is just so much that you can access. And you're right, Sue, about the leadership component. This is not, instead of, when we looked at it, it was very much this can be plugged into what already exists. And, you know, I think, you know, again, just spending some time thinking about how that might work. And certainly Suzanne and the Northwest Leadership team are doing some work with the national team as well to try and make it all plug in and fit together. And we'll get it we'll get it as good as we can, which is great. And Suzanne might talk a little bit more about that later on. So some great stuff coming through. So yeah, weave them into health and wellbeing conversations. Were some of the ideas, and maybe I can just flag up, Charlie, if you're okay, in relation to the what came out from the focus groups and became part of the recommendations to the Academy, the ideas that people thought and ways that the healthy leadership framework could be embedded. I'm just checking Charlie's there because I know she's had some technical. Brilliant, thank you, Charlie. So very quickly, these are some of the ideas that came out from the focus groups and conversations that we've had with people at different points in time. And I'm not going to go through each of those, but again, I think it does reflect that actually, you know, there are plenty of opportunities to find ways to build the framework in as part of what you do as an individual and teams and within organisations. And maybe just to draw your attention, actually starting with yourself and thinking about your self-leadership, because again, if you think about where does culture start, it's with an individual into the team and into the organisation. It's not a top-down process as a role. It's about how do we do this? How do we develop and define this together? So again, putting health and wellbeing as central to has to be the way forward to help teams to perform well and to have healthy organisations. But again, so some really practical ways that the framework could be used, and we're looking forward to seeing how that develops over time. So thank you, Charlie. If we could just move on. And as part of this, obviously, that many of you will be aware of the people plan that's intended to span, you know, not just health, but broader reach. And one of the ideas was that from that was the development of health and wellbeing guardians. And some of you have already sort of popped that into the session to say, you know, there is an opportunity here to galvanise with health and wellbeing guardians. How can they begin to embed? But not leaving it solely as their responsibility. Health and wellbeing is everybody's business, not just certain individuals within an organisation. So we thought what we'd do is just for, again, maybe just 5 minutes, if we could get you to think about what the role of the health and wellbeing guardian or a health and wellbeing guardian could be within an organisation, and how might they check out that the right things are in place to, again, support the health and wellbeing culture across the organisation. And we're really interested to hear if you've got any examples. So we had a conversation very recently with Steve Borman, who's again, you know, an expert in the field, and he was really interested to see how the role of health and wellbeing guardians was going to develop over time, with some discussions already starting around, you know, is it at board level? And if it's at board level, is it, you know, is it an executive role or a non-executive role? But actually, I think it needs to have a broader sense than that, and needs to connect up to more of the infrastructure within organisations, because we've got so many things going on, as you've identified, such as freedom to speak up guardians. So how would a health and wellbeing guardian interact with a freedom to speak up guardian? Might be something for us all to think about and consider. So again, Casey, if you're okay just to pop people and mix them up into breakout rooms. And again, we'll just give you a short amount of time, just 5 minutes, because we've still got quite a bit to get through that we want to share with you. So we'll see you in about 5 minutes time. Thank you very much, everyone.
If anyone does need a comfort break, please feel free to take one now.
Yeah. Yeah, good, making a quick cuppa, don't blame me.
Got hailstones now. Can you hear them?
Wow, that's
Really loud.
gosh. So it's interesting, the similarities between the UK and Tasmania. 4 seasons in a day, pretty much guarantee it.
True, isn't it? Yeah.
And the only reason I say that is when we went there, I'd never heard that said before, and I was thinking, that's exactly like Glasgow.
Yeah.
So just on this, Sue, the role of the Health and Wellbeing Guard.
The camera's on, fantastic. So any minute now, I'm going to see the du-du-du-du-du-du-du-du. Brilliant. Lovely. Oh, great, great. Okay, well, we've got a little challenge for you. Claire has come up with a fantastic idea as a bit of a pulse check about how you are. So you'll notice that myself, Claire and Lou and Juliet have already changed our name to reflect how we're feeling right now. So we thought we could encourage you to do the same. So all you would need to do is hover over your square, click on the 3 buttons, and you can find a rename yourself. So rename yourself in the spirit of how you are right now. Let's get a little bit of a pulse check to see how you are. That'd be lovely. And also, if we can invite you to put some of your thoughts and ideas in around health wellbeing guardians. And Claire, do you want to just say a little bit about Kerry Cooper's session last night and some of the discussions that were going on in relation to that, in relation to where health and wellbeing really needs to sit?
Yeah, so he was, I mean, obviously we might not all have health and wellbeing guardians. It's a new role, and I think it might be quite NHS specific, but I guess for other organisations, he was talking about developing director of health and wellbeing roles, and having those reporting directly to the chief executives. And he talked about one company who had already done that and had a chief wellbeing officer. So really starting to embed these roles at a very senior level can be quite helpful as well. Got some nice names coming into the year.
We have TGI. Thanks God it's Friday. Yes, Karen, yeah. And Lightbulb Laura, lovely, fantastic. Slow down, Sam. Fabulous, excited. Brilliant. Oh, brilliant. So I can see fill your glass Friday there. Yay. Brilliant. So what we're inviting people to do is to just rename themselves based on how they're feeling at this point in time. So you can see Chipper Claire, Sassy Sue, Friday Feeling Lou, Holiday Head Juliet. So it sounds like you must be about to go on leave. Chilling Nikki Tyson, fabulous. Good to see you. Yeah, good to see some chilling. And so if you want to remember how to do it, you just click on your little blue, hover over your own square, click on the blue 3 dots, and let it drop down, and you can do a rename. We've got Relaxed Ambreen, that's a lovely name, and Energize Adam, lovely. Being Better Betty, wow, okay. Busy Friday, goodness, great. So thank you for doing that. And if you could put in chat any sort of thoughts or ideas about health and wellbeing guardians, and as Claire says, they are a new role and they're just in formation. And I think they're a topic of, conversation that's going to be really important over the coming 6 to 12 months about how they really have an impact. So I'm looking at Boo Bouncy. I couldn't resist. Lovely. Thank you very much. So I think if it's okay, let's have a little just quick look at if there's anything in chat. Okay, maybe this is an area that we just need to keep having conversations around. Yeah. Oh, actually, thanks, Lorraine. So health and wellbeing guardians that need to have impartiality and hold confidentiality and have a bit of traction in the organisation is my sense. Really need to have some powers. I mean, that powers in a helpful, facilitative way. Be able to, you know, to highlight maybe where the pressure points are and pull in what needs to be done. Yeah, absolutely. So. Yeah, okay, we see ours as a voice at GB level. And that's, I'm assuming that's governing body level, advocating the work we are doing. Brilliant. Yeah, great, thank you.
Pam says that their group thought it should be a NED role, what
yeah.
would come forward from the organisation.
Yeah, and it's interesting, we would just reflect on it. We're still in this type of hierarchy, and you'd almost need to flip the organisational design round. So absolutely making sure that these key roles have power and at board have a connection to board level, but boards still are what they are, which are quite a limited number. So making sure the role really was front and centre, and just thinking how that be. But you know, keep those ideas coming. I think that it's, again, that there's different ways of doing it rather than just the traditional ways. But thank you so much for that. So I think we're going to hand over now to Claire. So thank you, been lovely to see all your ideas.
Great stuff, thanks. So we're just going to move on to thinking about kind of developing health and wellbeing strategies and needs analysis, and actually how do we take stock of what we're doing. So it links really to what we were talking about at the beginning. So Charlie's just put there in chat a link into Mentimeter. So if everyone would like to click on the Mentimeter link in chat and would like to complete, there's 2 questions. One is, does your organisation have a health and wellbeing strategy? And the other is, was the strategy developed by ... So if you'd like to click in the Mentimeter, or you can just copy and paste it into Google, and then I'll just share my screen and we'll see what you're doing around your own health and wellbeing strategies. There we go. So let's have a look. So far, does your organisation have a health and wellbeing strategy? We've got 12 people who said they do, but then no, 9 people said they don't. And then there's a few people, 10 people saying that they're not sure yet. So that's quite interesting. Obviously, it's important to take a strategic approach to supporting health and wellbeing, so that actually you can have a good overview about what you're doing. But actually, it's in the action as well. So the action planning is equally as important. Okay, so 15 yes. So yeah, so roughly 50% saying yes and 50% saying not sure or no, or slightly more. Let's have a little look at the other question. Was the strategy developed by? If you just want to complete that one as well. Okay. So we've got a few individuals from HR, health and safety, OD. Oh, so we've got other as well, by consultation with all employees. So just in chat, if you just let us know what the other was, that would be really helpful. That's great. Okay, so majority really are saying it was developed by a few individuals who got together, developed the strategy. But some people said other. So I'm just going to stop sharing now and just be really interested to hear what the other bit was. You just want to put that in chat for those who put other. How did you develop your strategy?
I'll keep an eye on that for you, Claire.
Brilliant, thank you. And if we can just get the slides up as well, if that's okay, Casey or Charlie.
Oh, here we go. So emergency care clinical team started the strategy and now have executive support. Amazing. Wow.
Okay. And Anne, do you want to tell us a little bit about why it started there? That's interesting.
Yeah.
How did that come about?
I work in Liverpool. We have 2 large hospitals which have recently merged.
Yeah.
And on the other site, about 2 years ago, one of the ED consultants started wellbeing strategy with one of their nursing staff, looking at initiatives to try and help out, because it's, as he puts it, a unique area in terms of the stresses of work. And with the merger, they're bringing the strategy across to the site I work on, and I'm trying to support from our end. So he's had 2 years to get going with the work, and he's kind of pulled out facts like incivility at work, the cost of that, the benefit to the workforce. I think we're still gathering data, and I'm being asked to gather data around the initiatives we're doing on our site. We've got talking therapy, drop-in yoga, we're getting a wobble room, we're getting a debrief facility, just making wellbeing a thing that happens. Simple things like posters, self-kindness checklists before you go home. So it's mostly within our division at the moment, but we've got exec support at divisional level. So we both now have job plan time to spend on coordinating the activity, making sure it's happening, the data's being gathered. But yeah, it's quite forward thinking, but as he keeps putting it, it's a unique area in terms of the stresses of work. You've got to just recognise that and look after your team, particularly this year.
Yeah, that's brilliant, Anne. Yeah, really, really helpful. Thank you for sharing that. And I think what you're saying there about actually different departments and different teams are going to experience different kinds of stresses. So actually, it's great to have a strategy, but actually, in terms of the action we take, we need to really know what's happening for those departments or teams so that we can address their needs. And I think, you know, from this morning's conversation, having things like the feedback machines enable you to do that kind of thing. So yeah, so that's great. Thank you for that. So if we can just move the slide on, if that's okay. Great stuff. I'm not going to put you into breakout rooms for this. I'm just going to ask you to pop it in chat now. So just have a little think about, if you know, what does your organisation do then to take stock of what it's doing to support your well-being at an organisational level? So what frameworks does it use? So Anne's just talked a little bit about some of the interventions that they're using in their organisation, but how do you take stock? I remember when I was working with an NHS trust and I was Health and Wellbeing Manager, and my challenge was to find out what was going on across the organisation. And it was really, really tricky to do. It was multiple sites, etc. So actually trying to find out, there was some netball going on, you know, there was some mindfulness going on, but it was kind of little localized things, which is great. But actually, I don't think anyone had an overview at that point about what was happening across the organisation. So how do you know what's going on across your organisation? So there's some examples we put here. Some of you may be using the NHS Health and Wellbeing Framework, which I know is getting refreshed at the moment, and I know Adam's here today and he's supporting that process. The Workplace Wellbeing Charter is another framework, the NICE guidance, also Investors in People Health and Wellbeing Award. So just pop in chat if you know, what is your organisation currently doing to take stock? Yeah, so Lorraine says that they've got a health and wellbeing working group, that's sense check. Which is great, and the group is representative from different teams. Brilliant. Yeah. So Joe said, Calm Joe says they're going to work with the creative agency to help about the whole offer. That might be relating to the previous question. Rock Chick Alley, like it, is held listening events quarterly. So that and they also use the Workplace Wellbeing Charter and the NHS Employers Framework. Yeah, lovely. Karen, Karen, who's feeling positive, is developing an ED&I strategy. Great, and more, I think health and wellbeing and kind of ED&I really does fit together, doesn't it, and sit together. So linking that together is really important. Calm Joe has a strategy group as well. Yeah, Boo Banksy's creating a wellbeing forum and having champions. Yeah, so wellbeing champions on that as well. Great stuff. So steering groups, lovely. Okay, thanks for that, Nikki. So that's it, Chilling Nikki and Ruth Knighton. We have used the Healthy Leadership Behaviour Framework. Pandemic has trumped some of this work. Okay, yeah, so some of this may have been interrupted due to the pandemic. But I guess you've learned from the pandemic, Ruth, and being able to integrate that into moving forward with some of that work. Ruth, do you just want to say a little bit about that?
Sorry, there's a bit of background noise in here. I don't know if you can hear me okay.
Yeah, we can, Ruth, yeah.
Hi, everybody. Yeah, so we used that framework just before the pandemic hit. We were just finalising the report and looking at that, and obviously we were then taken down a different route. We're in the process of bringing it back. We've got a strategy steering group chaired by somebody not in HR, which is great. We've got some clinical leadership there. And we're just going to take stock and look at what's really important, because a lot of the work that was in it has been taken forward. You know, staff rest areas and things like that. It's got a lot of investment in the last few months in particular. But yeah, we just need to pick off what the priorities are, really. And with the staff survey results just recently coming out, it gives us an opportunity to really drill down into, well, this is what could potentially make the most difference. So I'm not sure if that's what you wanted, because I had to step out for about 20 minutes.
Perfect, Ruth, thank you. That's really helpful. Thank you for that. Yeah, great. Yeah, so health and wellbeing breakfast meetings as well, all that, brilliant. So if we just move on to the next slide, that'd be great. There's still lots of good stuff coming into the chat, so we will save the chat, which is great. So one of the things that I just wanted to share, and I know some of you are already doing this, is thinking about assessing needs. And this is an example from the Ministry of Defence, and there's a person called Martin Short who went to work for the What Works Wellbeing Group and then came back and wanted to implement a health and wellbeing strategy in his own organisation. And I guess he's very honest, it was very much a starting point in the organisation when he started to do the work. And what he did is he basically took a three-pronged approach, and he called it educate, measure and connect. And what he did is he went round, and you can see there from this little dashboard, he's got 8 sites which he was supporting. And he went round to those sites and he started to do one-off presentations about wellbeing, just to start to have a shared understanding about what it was. And so that people could start to think it's okay to start to talk about this kind of stuff. So he did that, and he talked about why wellbeing matters in the workplace. And that was the educate bit. And then what he did is he measured. So what he did, and this is the measurement, if you like, the snapshot of the measurement he took. So he used some metrics. So you can see he's got some wellbeing indicators there. So we asked people about life satisfaction, etc. And then he asked people about the drivers of wellbeing. And these are the things around health, relationships, environment, security and purpose. And what he was able to do then is produce this heat map, which showed how people were feeling in terms of wellbeing and what the drivers were. So, for example, if you look at site 5, you can see there that they kind of flashed up as red in terms of life satisfaction and experiencing anxiety. And you can have a look there, you can see financial security seemed to be something that was really triggering that, because that's also kind of showed up as red. So what he was able to do, he was able then to kind of really develop localized action plans with the sites in order to support the health and wellbeing needs of people working within those sites. So so it's just a really nice way, and it's quite simple, a visual, you can see what's going on, which is great. And then the last bit he undertook was connect, and that was to take stock of all of the interventions that were already happening across the organisation. So some of you may already have heat maps like this. If you do, put it in chat, let us know. Do you have heat maps, and do those heat maps go to your boards? That'd be quite interesting to know. Do you have a heat map? Yeah, so Nikki says, yeah, love the heat map approach. Yeah, let us know if you've got anything like this that goes to the board, to see how it's being reported to the boards rather. Okay, so we just move on to the next slide. And also, what's some of the softer intelligence that we can be using? So I know as part of the, in the NHS in particular, part of the people plan, there is a need now to have those health and wellbeing conversations, and that's really important. And I know Jill Fazey's been doing some work around this as well. So how could these be used to assess needs as well? Because obviously we can use questionnaires, we can use your feedback machines, etc. But I guess there's some softer intelligence that we could also be using to help inform what we do to support people. So at the moment, again in chat, is anyone aggregating the data from health and wellbeing conversations? Anyone using that to support a needs analysis? Anyone like to put into chat there? Yeah, Boo Bouncy, the links to the Ministry of Defence work will be at the bottom or back of these slides as well. So yeah, there's a case study as well by Martin Short talking about his approach. So health and wellbeing conversations. Anyone use other softer intelligence to do this needs analysis? What's people using? I'll let you have a think about that. I'll let the chat keep running. Okay, if we just move on then. Okay, so so this is an example of a framework that we developed. So Juliet alluded to this at the beginning when she did the introductions. So back in 2015, Sue and I and a couple of other colleagues were asked to do a piece of work. So we tendered for a piece of work and we were successful, and it was for the Manchester Health and Wellbeing Board. And what they wanted to do is they wanted to develop a tool which enabled them to take stock around what they were doing, because they wanted to be exemplar employers around health and wellbeing. And at the time, I think the existing frameworks were there, but they didn't have a big focus on mental health and disability, and that's what the Health and Wellbeing Board wanted. They wanted to take stock in those areas as well. So they asked us to develop a tool to enable those organisations who are members of the Health and Wellbeing Board to take stock about what they were doing around health and wellbeing. So this is the framework that we developed. It has 4 domains. And as you can see, each domain has a goal, and then it has a number of sections. And it's basically an Excel spreadsheet, and you can fill it in and you can provide evidence into this Excel spreadsheet. And this is free. So if anyone wants a copy of this at the end of the day, you can have a copy of the link and you can use it within your own organisations. And if you just move on to the next slide, this is what you get. Then you get like a dashboard, and it shows you what percentage you are in terms of progressing against each of the domains. And so again, nice little snapshot there, easy to look at, and you know where you need to be focusing on the work. So we just move on to the next slide. Brilliant. So in terms of process about how we've used this, so organisations can take the Excel, use it themselves, or we can support organisations, and this is what we've done. So this is the process that we've tended to take. So when we've been invited to work with organisations, we've tended to have an executive sponsor, and I think that's really important that the work does have an executive sponsor. And then what we've done is we've worked with the executive sponsor to identify people from across the organisation to form a bit of a focus group to start to do some of the work to populate the Excel spreadsheet. And for example, that might involve HR, might involve estates, it'll involve clinical leads, a whole range of people from across the organisation come together. We share with them the tool, and we share with them how to assess themselves. And then what we did in the first focus group, or what we tend to do, is we get them basically to start to populate the first domain together in the room. And then what we do is we split the other domains up, and then people go off and they start to collect the evidence against the other domains. Then we bring everyone back together. And what we've done in the past is we've then got, so if I was supporting the development of the evidence for the first domain, I'd then swap with someone else and I'd look at what domain 2 was and have a look and make sure the evidence seemed okay. So it's a bit of peer validation, if you like, a bit of a robust assessment. So we're not marking our own homework, if you like. So then what we've done then is we've then populated the Excel spreadsheet in the second session so that you've got that dashboard. And then it's been a case of developing an action plan so that then we can share that with the group and that they can sign it off and and then start to work with that action plan. So that's the kind of process that we've taken, and I'm sure you've taken similar processes when you've used other frameworks that you've been using to take stock. But taking stock's important so you know what's going on. However, I think the needs assessment being localised is key. I think no one strategy is going to fit all, and I think that you've alluded to this today as well, and you've said that in the chat box. So really doing a needs assessment, but also making sure you know what's going on across your organisation, because there could be really great pockets. You know, it's really interesting. When I was working with one of the organisations as a member of the Health and Wellbeing group, it's like I was working with a colleague and they said, well, actually, I can go and ask so-and-so if they're doing anything on this. And it was great to form links as well. So it was linking up ED&I. It started to link up estates. It started to link up you know, people who were looking after health and safety. So it gets that conversation going. So it's a good process to use. So the tool is free to use if you want to use it, and there'll be a link on the slides at the end. So we just move on. Great stuff. So we're just now coming to the end of our presentation. So as you can see, we've put all the resources on the slides. There's two slide decks of resources, and so they're there. And please feel free also to contact Sulu or I if you want to chat through anything else from today. We'd be more than happy to have a chat. You know, we're really passionate about getting this stuff out there. You know, there's loads of free stuff, but sometimes it's just like where to start. So please do get in touch. I'd just like to hand over to Suzanne Douglas just to see if she'd like to say anything about the Healthy Leadership Framework.
Thank you, Claire, and thank you, everyone. I think there is a slide for this one, if someone can move the slides on. Is that okay? Yeah, fantastic, thank you. So I don't need to introduce myself, you can see there. Some of you may already have connected with me in some way, shape or form, but just to say, absolutely lovely to be here and really fantastic to start to see the work coming to life, and absolutely hearing others' thoughts and insights around the work as well, and please do continue those as well. I'll actually, at the end, I'll share my email address in the chat box as well, or if Vicky from our comms team doesn't mind doing that while I'm chatting away, that would be absolutely fantastic. So really my part at the end was just to signal in terms of some next steps really with the Healthy Leadership Framework. And before that, I just wanted to give very short, because I'm conscious of time, just context really from an NHS North West Leadership Academy perspective, and just to say that we've kind of been in the space for leadership development, health and wellbeing, so not the holistic health and wellbeing, but the leadership development element for probably 6 or more years now, and we've really focused around one-off interventions and offers in terms of individual and team level developments at a senior level, and we really recognised that, you know, we had absolutely great quality feedback, and we could absolutely see in terms of where that learning was being put in place and transferred by leaders that had touched our offers and interventions, and also the team offers. But we also recognised there was a need for something else within this space as well, which absolutely prompted the work we commissioned Health and Wellbeing Inspiration around a wider scoping and understanding of the interrelation between leadership and health and wellbeing and what that meant, and particularly was really interested around the whole organisational culture piece as well, and what absolutely needed to happen within that space. So I suppose it was to give that context really. And what next for us? Well, there's been lots of connecting and exploring and shaping in terms of, we're really conscious that Vicky's kind of shared and I've shared previously, you'll probably see it in the chat bar, the products that we've got from the outputs, and there's a great evidence base there with the full research. There is a short synthesized flipping book, and there is also a summary of the behaviours as well on a one-page, which you can kind of just print off and just have that available, which is great, and some suggestions around how you can use that. What we are really conscious of though is absolutely making sure that this work comes to life, and we're supporting and enabling some of that process as well. So we've been doing lots of connections with national colleagues in terms of just joining up some of the dots on this, as Claire kind of said earlier. So we've been connecting to national colleagues, and some of you may have already connected to our national colleague, Adam Turner, who is here today. And Adam, you might want to drop your email into the chat box. But we've been working with Adam nationally around some work with the Health and Wellbeing Framework, which is being evolved. And I've seen kind of people that have referenced that it is NHS England an improvement Health and Wellbeing Framework, and is hosted in terms of NHS employers, and it's been around since 2018, and really kind of gives a frame for the approach to health and wellbeing within organisations, and a diagnostic that sits with that. And there is a current evolving of that work at the moment to really make sure that there are some resources and support that sits with that framework, and the healthy leadership framework will absolutely fit as part of that and will be connected to that. And we're really looking in terms of, from a Northwest perspective, sharing back case studies to support within that health and wellbeing framework as well. So there's absolutely interconnections from a national perspective. We are also, after today, going to be doing a regional comms campaign as well. So if you follow us on Twitter, you'll absolutely see all of the resources and links being shared out. The links for the website have already been shared in the chat bar, so you can absolutely pick up all the products there. And although it's NHS, they absolutely, what is in that framework can cut across absolutely any sector. It really can. It's just the branding on that, and I suppose that's just one thing to reference there, really. Beside the branding, that is a product that can be used anywhere, and I would absolutely really encourage, in terms of you absolutely taking away that framework, exploring that, come back in terms of if anybody has utilised the framework within their organisations and wants to share some of those insights, and we'll absolutely work with you to share and put some case studies around that, and would be really great to hear some of that as well. So I've just seen that Adam's just added a link into the chat bar as well, which is fantastic. Thank you, Adam, in terms of a link to the refresh for the health and wellbeing framework. So that, Claire, is it from me. Thank you.
That's great. Thanks very much, Suzanne. That's great. And thanks, Adam, for putting your details in there as well. So we're going to hand back over to Juliet now, just to close the event, if that's okay, Juliet.
That's great. Thanks very much. And just wanted to say, I've been taking loads of notes. There's so much rich content in there. I think this, it's been really, really timely as, organisationally, but also I kind of put in the chat regionally and nationally, there's an effort to really improve health and wellbeing services across the whole of the country. I think there's been lots of great chat in the chat box about that as well. I've learned new skills. I didn't realise you could download chat yourself, so I'm doing that. So if nothing else, I've learned something more about Zoom today, which is fab. I just wanted to say really thank you to everybody who came today, all the participants. I want to say thank you really to Sue, Louise and Claire for the content that they brought and the tools and everything they've curated together for us. It's been really helpful. Want to say thank you to the Legs of the Swan, which is Charlie, Alana and Cassie. So they've been our tech support and they've been helping in the background, making sure that this event is running smoothly. Thanks to Sue Antrobus, who is pivotal at pulling all this work together for us on behalf of the 6 organisations that form the Collaborative Masterclass series, without whom none of this would really happen. So thank you so much to Sue for doing that. I'm going to leave you all there. In Liverpool, we started with a rainy day. The sunshine is out, I'm really pleased to say. So something wonderful's happened. And I'm sure all the great vibes in the meeting today has contributed to that. So if the sun is shining over where you guys are, make sure you get out today for a walk or some fresh air. It's great for your well-being. Get away from the screen. So I'm going to just thank everybody again, and just to say, go well, and I hope to see you at a future event.